Covering news that matters. Fox 23 News at 5:30 starts right now.
Glad you're with us here at 5:30. I'm Shay Rozzi. Nathan has the night off. As we continue our series on menopause, tonight we're taking a look at the connection between menopause and heart disease. Fox 23 weekend morning anchor Alexa Mostrom sat down with a cardiologist and a member of the American Heart Association to learn how women can best prepare themselves for this change.
As a community, all women go through this, and I am excited that we are talking about it in a more public platform than we have in the past.
Most women hear the word menopause and think hot flashes and mood swings. But one thing you may not realize it impacts is the risk for heart disease. Don't panic, menopause itself does not cause heart disease or the risk, but it can increase heart disease risk factors.
During that change period, risks that might have otherwise been minimal or risks that we might not otherwise have known may either come front or may become more pertinent or prevalent, which then can increase your risk for heart disease.
As a woman in her 20s, I admittedly did not know much about menopause. After doing some research, I reached out to Dr. Kunal Sangal, a cardiologist with the St. Francis Heart and Vascular Institute. He explained we all already have risk factors for heart disease. Things like cholesterol, blood sugar levels, body mass index, and blood pressure can all increase the chances of getting heart disease. Menopause does not cause those things, but it can alter them and make them more prevalent. I asked him, what are some things we should be watching for?
You start to notice, hey, I could do something and now I can't do it as readily, whether you're limited because you're short of breath, because of pain, fatigue.
And how do we tell the difference between a symptom of heart disease and a side effect of menopause?
Heart disease, once had, doesn't necessarily go away. Menopause tends to be kind of more episodic and temporary. The hot flash comes, the hot flash goes, but it's not necessarily consistent or in a pattern. As compared to heart disease, if there's a certain amount of stress on your body that causes it, it's going to consistently cause it.
Dr. Sangal says advocating for your health is vital. If a doctor dismisses something as a side effect of menopause and you don't feel right about it, get a second opinion.
Women are not just little men. Women are going through different phases that affect their bodies very differently as compared to men, and it should be something that's taken seriously and making sure that they're seen that way.
I sat down with Susan Bream with the American Heart Association. She told me her biggest advice for women is to get annual checkups.
I've heard too many women say, I'm so busy with family, with work, I'm not feeling bad, I have to cancel that. Well, I will tell you that I've talked to so many women that had they not gone to that annual checkup, they would have not been detected with heart disease, and it would have turned into something far more critical than something that they could treat because it was diagnosed early on.
She also says it's important to get ahead of risk factors while you're young. So when you enter menopause, you're already on top of it.
It can be as simple as, I'm going to park my car further in the parking lot and walk. It doesn't have to be, my office is on the 5th floor, I'm going to take all 5 flights of stairs. It could be, I'm going to take the first flight of stairs and I'm going to get on the elevator on the 2nd floor and take that up.
Susan says talking about menopause and normalizing it can be really helpful in spreading awareness on the different ways it can affect women.
It is a normal part of our lives, and the more we talk about it amongst ourselves, with our husbands, with our doctors, the more knowledge and information we'll have, and the more we'll all be able to come together to support each other and encourage each other along the way.